what are your thoughts about fluoridated toothpaste, and what are your thoughts about whitening teeth? Are either of these appropriate, and are they a health issue? Please comment.
Yeah. So, all right, I'll try and do that quick. All right. Fluoride is a hoax. Okay. Fluoride was introduced, and a lot of the studies on the working with fluoride were done in Grand Rapids in the 1940s. And fluoride is a toxic halide chemical. Fluoride toothpaste has a poison warning on it. Why? Because in 1988, Procter & Gamble launched a product called Crest Sparkle. It was fluorescent blue and had sparkles in it, and it tasted like bubble gum. And fluoride fatalities in children went up 280%. A lot of people didn't know about that, because that little piece of information prompted the FDA to mandate a poison warning on toothpaste with sodium fluoride. That took them 10 years. And in 1998, the poison warning on toothpaste was introduced, which says keep out of reach of children. If more than a pea-sized amount is swallowed, call poison control right away. Why are children putting poison in their mouth? Under the guise that this chemical stimulates teeth to remineralize. And they do remineralize. It converts our natural teeth and bones, which are made of a mineral called hydroxyapatite, and it converts it to something called fluorapatite. And nobody ever talks about the difference between hydroxyapatite and fluorapatite. Hydroxyapatite has a little flexibility. It gives our teeth and bones some flexibility. Fluorapatite is rigid, very hard, like this glass. And if I drop this on a cement floor, it's going to break in a million pieces. Well, lo and behold, it does the same thing to your teeth and bones. Your teeth and bones are up to 33% weaker, or more than 33% weaker. That mineral, fluorapatite, is weaker tensile strength. So when my mother tripped on the stairs of our home in the 1980s, she didn't get a bruised hip. She got a broken hip after 25 years of water fluoridation. Fluoridation was never accepted in Europe because for the simple fact that there are numerous studies linking fluoride to osteoporosis. And over 60, I think 70 studies now globally linking drinking fluoridated water to lower IQ in children. So it's time to end the fluoride experiment that we thought was such a heck of a good thing. And there are dentists and dental hygienists and dental students who are fed this stuff every day that fluoride is good. Everybody needs fluoride. Fluoride is not a nutrient, everyone. It has no nutritional value. It is not safe and effective, and it's linked to a lot of systemic problems. So should you use fluoridated toothpaste? I give a very long answer, but the answer is no.
And what about white?
That's a great answer. And then Jerry, I'll let you come back on the whitening in a second. But
all right,
even in my own products at Great Oral Health, my toothpaste, I spent about 12 years. I guess I wasn't very bright, but it took me about 12 years to develop. But there is no fluoride in that thing, and there never would have been fluoride in that, because we have better alternatives to help remineralize the teeth. As Jerry was saying, hydroxyapatite, we can actually place hydroxyapatite in the formulation to help the body get its own chance to remineralize itself. And Jerry, lastly, I read studies over in China where the elderly women, their backs are breaking because they bend over a lot anyway, but they get severe osteoporosis, and it's because they drink so much tea and they have a high concentration of fluoride in their water. So, I mean, it's self-evident out there. And even our own American Dental Association, apparently in 2004, came out with the bold statement to say there is no systemic benefit from drinking fluoridated water. That same year, I believe it was the county of Los Angeles, or Los Angeles overall, they decided to fluoridate the water. What the heck is going on? It makes no sense.
And you know, people don't realize this. The fluoride that gets dropped into the water supply, they have to wear hazmat suits to put it in there. And
Yeah.
it's not even fluoride. It's an element. It's hydrofluorosilicic acid, the same stuff they make sarin gas from. And it is so toxic. It is a toxic vapor that comes off of it. So they literally wear hazmat suits, dump it in the water for no real systemic benefit. It doesn't work. There are fluoridated communities with higher rates of decay than non-fluoridated communities. And I have spoken about this many times over many years. And incidentally, Paul, I spent 25 years trying to develop, and I have a product called Whitening, and it's nutritional. Basically, it was nutritional and homeopathic, and now it's completely prebiotic to nourish and support the natural oral environment. We just did a double-blind, 40-patient, double-blind clinical research study, and we blew Colgate Total out of the water because and that's loaded with stannous fluoride, and reducing inflammation and reducing film thickness of the biofilm to a healthy, a healthy microbiome in the mouth is a clear odorless film. You don't even know it's there.
Yeah.
And an unhealthy biofilm or microbiome, which is another made up word in 2002, but that's this sticky yellow film on your teeth in the morning. That basically is out of balance, a microbiome that's out of balance. So
well, Jerry,
let's talk about teeth whitening.
I know this is for the entire podcast, but I'm going to call you because I want to collaborate with you on some of those things.
With pleasure.
Because, I think we can change the suffering worldwide with the right product lines, et cetera. So, whitening, I would tell you, the whitening products out there, my viewpoint is there's a lot of good ones. You want to try to get ones that are pH balanced the best you can, and then be using remineralizing toothpaste that have hydroxyapatite to help keep the original strength back, because when they whiten, they create micro lesions on the surface of the teeth, but the body does remineralize that. So it's not long-term harm unless it's high concentration.
Totally agree. I just, there's a lot of talk about nanoparticles in products and toothpaste products. And there's a lot of studies that have emerged about the danger of nanoparticles damaging DNA in soft tissue and cells because they penetrate the cell membrane and can enter the nucleus of the cell. So I caution against that. But teeth whitening, what is teeth whitening? It is oxidative. So it is an oxidative process. And what it does, teeth whitening, is it penetrates the enamel rods, opens them up, and then oxidizes what we call intrinsic stain in teeth. There is a study from 2006, Georgetown Medical Center. 4 women were diagnosed with squamous cell carcinoma, side of the cheek, under the tongue. And they were not smokers, not drinkers. They didn't have HPV virus, the 3 biggest risk factors for cancer, oral cancer. 3 biggest risk factors: alcohol, tobacco, and HPV virus, which is the biggest one now. But one thing they had in common, they all were bleacherexics. They were all bleacherexics. They all used the home whitening products, and they were bombarding their mouths with this oxidative process. And what they found is that oxidation and over oxidizing, right, destroying the antioxidant protection, causes DNA damage in the cells of the soft tissue. And the cells go from normal to abnormal to cancerous. And that's the danger of the overuse of these home whitening products. And with this oxidation, which is usually a form of peroxide, hydrogen peroxide, carbamide peroxide, which is a derivative of hydrogen peroxide, but that's teeth whitening in a nutshell. And so the only way that I recommend teeth whitening, and I everybody loves it, and yes, as you get older, I know your enamel gets a little more translucent, so being able to whiten your teeth safely should be done in a dental office where we isolate the soft tissue, whiten the gums. And then what I do is I use an antioxidant gum mask after we whiten. So that's the nutshell on whitening. Whitening can be harmful if the bad products used at home that are not controlled, and people can just keep doing it without any control, just like exposure to fluoride, by the way. 62% of children have fluoride damage right now called
Yeah.
fluorosis. By the way, it's not just their teeth, it's their bones. And 62%. Why? Because we can't control the amount of that drug people are getting, right? Because they get it in toothpaste, they get it in mouthwash, they get it in food they eat in a restaurant made with fluoridated water and drinking fluoridated water. So you can't control it. So please be aware that you may be getting too much of this that you don't even want in the first place.
Okay, what works to keep our teeth strong? Are there supplements or diet that is good for that?
I would say just go ahead, Jerry. But I would say that you want to be making sure that you're taking the fat soluble vitamins, keep those in. Last week, I was on the podcast with your show, Real Truth About Health. And I was talking about it, plant-based diets, vegan diets. They can be deficient in the heavy fat rich vitamins.
So many
A,
kids don't get
D,
enough
K,
omegas.
and omegas. They also are deficient in phosphorus, calcium, magnesium, and some studies show arginine. So if they have a problem with arginine, plaque's going to really heavily stick to their teeth, etc. So those are some of the things that I would recommend along that line, and everybody should take those anyway.
Yeah, absolutely. You know, I did some research back in 1999, 2000. I found a study from Japan, a Japanese dental researcher biopsied diseased gums, and he found that they were deficient in 2 key nutrients. One of them was vitamin C. We knew about that because sailors on ships got scurvy from deficiencies in vitamin C. And actually, a great dentist did so much research on vitamin C deficiency. His name was Emmanuel Cheraskin. He wrote books on the magic of vitamin C for the mouth. But the other one was one that was relatively unknown back in the 90s. And I had a friend, Steven Sinatra, who recently passed. He did the most amount of research on it. He's a cardiologist. And it was coenzyme Q10. So CoQ10 and vitamin C were fantastic. And I started experimenting, mixing this up in the back of the office and applying it on one side to the gums of patients' teeth. And lo and behold, gums stopped bleeding in a matter of days. So because vitamin C and CoQ10 are so powerful for oral health, for not only healthy gums, but healthy teeth. The other thing, I agree with Paul, fat soluble vitamins, but we used vitamin D3 and K2. So Revitin has 3 patents on vitamin C and CoQ10 that we got back in early 2000s. And then we put vitamin D3 and K2, which are the gatekeepers for calcium metabolism. And then in addition to that, vitamin E and even MSM, which is a connective tissue enhancer, and actually stimulates stem cell releases in periodontal ligaments. So really, really fascinating. So what is all this? What Paul was talking about, what I was talking about for your question, Steve. Healthy teeth need healthy nutrition. And that's a big thing. So much bad nutrition and lack of essential fatty acids and oils, really.
How do we keep our gums healthy and avoid pockets?
All right, Paul, you got to take that.
I'm sorry, I don't mean to be laughing about that. It's a serious thing, but well, I think we have to. It goes back to nutrition. Obviously, people are genetically predisposed a bit, but if the nutrition is right and if they can rebalance, look, I mean, the major diseases that are considered truly epidemic, pandemic is gum disease and tooth decay. Those things are a bacterial imbalance. So if we can calm the bacteria that are causing it down, and then we can rebalance the area, again, as I mentioned earlier in the show, with the like Jerry has prebiotic, probiotic, etc., to encourage the overgrowth of healthy beneficial bacteria, we can get back to back to a healthy mouth and gums. So for example, even on the probiotics that I have at Great Oral Health, we get so many people, they call in and within 3 to 5 days, 7 days, that's great. But I always tell people it's going to take about 3 weeks for the microbiome to change. But they tell us the bleeding starts going away, it drops down. What's happening? This is great. My hygienist says this is amazing. So, but again, we're sort of treating the symptoms there. The
Right.
real answer long term is putting the correct nutrition back in that'll bring about this balance. And you
Right.
know, a friend of mine's writing a book. It's called The Unholy Trinity. And of course, it's the big problem out there is carbohydrates, sugar, and the bad cooking oils that are being used. So couple that with good nutrition on top of that, get rid of the sugars, get rid of the refined carbohydrates, and you're going to have not only healthy teeth and gums, but
Get rid of
you'll
the bad
have
oils
a
like
better
canola
lung.
oil and all those.
Yeah, you're going to feel all the other illnesses and disease. They're reflective many times in bad health that we see in the mouth. So if the mouth is healthy and it's strong, generally the body is pretty strong and healthy.
Yeah, one of the greatest educations that I received as a dentist was from a medical doctor who I met back in the early 90s, who, if you had something wrong in your body, if you had anything from breast cancer, prostate cancer, autoimmune disease, or whatever else, chronic fatigue or anything, the first place he would look was your mouth. And his name was Thomas Rau, and he had a clinic called the Paracelsus Clinic in Switzerland. And he did remarkable things with patients. And it just opened me up to really going over there myself and spending time and really looking at this amazing philosophy of biologic medicine, which says this: our bodies have this divine life force that gives us the ability to self-regulate and heal. And what gets in the way of that life force is interference on a number of different levels: biologic, biochemical, energetic, psycho-emotional, and spiritual. And those 5 levels on the bottom level, biologic, people don't realize that gum disease is the body's #1 source of chronic inflammation that's linked to everything from Alzheimer's disease to colorectal cancer. Colorectal cancer, the #1 bacterium found in colorectal tumors is Fusobacterium nucleatum, which is the most common bacteria in the mouth. And so I always look at the patient as this divine life force that's inhabited by the tent of the body. And I always respect that their ability to heal. And what we do as dentists is we help them on their path, whether it is helping to rebalance, as Paul said from the beginning, their microbiome in their mouth, to really even helping them understand how their body, how they are a composite of species, mind, body, and spirit. And that spirit in biologic medicine we call a field. It extends 1.5 feet from our body, and it can extend. We can expand that even more. But that field is your life force, and that we call spirit here. In Ayurveda, they call it prana, and in Chinese medicine, they call it qi. But that's foundational to understand how to be healthy, and that's the real truth about health. The real truth about health is understanding that, in my opinion.